How to treat and cure cutaneous T-cell lymphoma. Cutaneous T-cell lymphoma, CTCL, is a class of non-Hodgkin lymphoma, which is a type of cancer of the immune system. Unlike most non-Hodgkin lymphomas, which are generally B-cell related, CTCL is caused by a mutation of T cells. The malignant T cells in the body initially migrate to the skin, causing various lesions to appear. These lesions change shape as the disease progresses, typically beginning as what appears to be a rash which can be very itchy and eventually forming plaques and tumors before metastasizing to other parts of the body. Lymphoma is the most common blood cancer. The two main forms of lymphoma are Hodgkin lymphoma and non-Hodgkin lymphoma, NHL. Lymphoma occurs when cells of the immune system called lymphocytes, a type of white blood cell, grow and multiply uncontrollably. Cancerous lymphocytes can travel to many parts of the body, including the lymph nodes, spleen, bone marrow, blood, or other organs, and form a mass called a tumor. The body has two main types of lymphocytes that can develop into lymphomas: B lymphocytes, B cells, and T lymphocytes, T cells. T-cell lymphomas account for approximately 15% of all NHLs in the United States. There are many different forms of T-cell lymphomas, some of which are extremely rare. Most T-cell lymphomas can be classified into two broad categories: aggressive, fast-growing, or indolent, slow-growing. One of the most common forms of T-cell lymphoma is cutaneous T-cell lymphoma, CTCL, a general term for T-cell lymphomas that involve the skin. CTCL also can involve the blood, the lymph nodes, and other internal organs. Symptoms can include dry skin, itching, which can be severe, a red rash, and enlarged lymph nodes. The disease affects men more often than women and usually occurs in men in their 50s and 60s. Most patients with CTCL experience only skin symptoms, without serious complications. However, approximately 10% of those who progress to later stages develop serious complications. Early-stage CTCL is typically indolent. Some patients with early-stage CTCL might not progress to later stages at all, while others might progress rapidly, with the cancer spreading to lymph nodes and/or internal organs. Cutaneous T-cell lymphoma is a rare type of cancer that begins in the white blood cells and attacks the skin. Cutaneous T-cell lymphoma is one of several types of lymphoma collectively called non-Hodgkin lymphoma. Cutaneous T-cell lymphoma can cause rash-like skin redness and, sometimes, skin tumors. Treatments can include skin creams, light therapy, medications and radiation therapy. Several types of cutaneous T-cell lymphoma exist, including mycosis fungoides and Sézary syndrome. Cutaneous T-cell lymphomas may be divided into the following types: mycosis fungoides, pegatoid reticulosis, Sézary syndrome, granulomatous slack skin, lymphomatoid papulosis, pityriasis lichenoides chronica, pityriasis lichenoides et varioliformis acuta, CD30 plus cutaneous T-cell lymphoma, secondary cutaneous CD30 plus large cell lymphoma, non-mycosis fungoid CD30 cutaneous large T-cell lymphoma, pleomorphic T-cell lymphoma, Lennert lymphoma, subcutaneous T-cell lymphoma, angiocentric lymphoma, blastic NK cell lymphoma. Types of cutaneous T-cell lymphoma. CTCL describes many different disorders with various symptoms, outcomes, and treatment considerations. The two most common types are mycosis fungoides and Sézary syndrome. Mycosis fungoides is the most common type of CTCL, with approximately 16,000 to 20,000 cases across the United States, accounting for half of all CTCLs. The disease looks different in each patient, with skin symptoms that can appear as patches, plaques, or tumors. Patches are usually flat, possibly scaly, and look like a rash, Plaques are thicker, raised, usually itchy lesions that are often mistaken for eczema, psoriasis, or dermatitis, and tumors are raised bumps, which may or may not ulcerate. It is possible to have more than one type of lesion. A medical history, physical exam, and skin biopsy are essential for diagnosis. A physician will examine lymph nodes, order various blood tests, and may conduct other screening tests, such as a chest X-ray or a computed axial tomography (CAT) scan. Scans are usually not needed for those with the earliest stages of the disease. Mycosis fungoides is difficult to diagnose in its early stages because the symptoms and skin biopsy findings are similar to those of other skin conditions. Sézary syndrome is an advanced, variant form of mycosis fungoides, which is characterized by the presence of lymphoma cells in the blood. Extensive thin, red, itchy rashes usually cover over 80% of the body. In certain patients, patches and tumors appear. Patients may also experience changes in the nails, hair, or eyelids, or have enlarged lymph nodes. Many of the same procedures used to diagnose and stage other types of cutaneous T-cell lymphomas are used in Sézary syndrome. In addition, a series of imaging tests may be needed to determine if the cancer has spread to the lymph nodes or other organs, although that uncommonly occurs. These tests may include a CAT scan, a positron emission tomography (PET) scan, and/or a magnetic resonance imaging (MRI) scan. A bone marrow biopsy may also be done, but is usually not necessary. Treatment options. Treatment selection for CTCL depends on the extent of skin involvement, the type of skin lesion, and whether the cancer has spread to the lymph nodes or other internal organs. For mycosis fungoides, treatment is either directed at the skin or the entire body, systemic. Because Sézary syndrome is chronic and systemic, affecting the entire body, it is usually not treated with skin-directed therapies alone. Treatments may be prescribed alone or in combination to achieve the best long-term benefit. Many patients live normal lives while they treat their disease, and some are able to remain in remission for long periods of time. Skin-directed therapies are useful for patch and limited plaque disease and include topical treatments such as corticosteroids, retinoids, or imiquimod, which activates immune cells, topical chemotherapy, local radiation, methotrexate, photopheresis, ultraviolet light, phototherapy. Food and Drug Administration, FDA, approved meshlorthamin gel, Velschler, for the topical treatment of patients with mycosis fungoides, a type of cutaneous T-cell lymphoma, CTCL, who have received prior skin-directed therapy. This represents the first and only FDA-approved topical formulation of meshlorthamin. This treatment was previously approved as an intravenous treatment for the same disease.